today is discuss the different areas of accessibility from things such as geographical to cultural things, as well as language barriers and so forth. I want to go ahead and express that our approach to providing accessible care must be just as diverse as the communities that we all serve in. And the goal is to create an environment in Tennessee where all women, regardless of their background, feel supported and that they receive the care that they need. I'm excited to be leading this very important discussion. And I want to personally, by the end of this webinar, be able to equip you guys all with more insight and possibly strategies to provide a more inclusive and access to care for the women in your community. So, by the end of the webinar, I hope that you guys will not only have an understanding of the challenges that women are facing, but that you also will gain practical knowledge and possible strategies and interventions that you can add to your organization that will contribute to a positive change. So I'm looking forward to making a very meaningful impact with you guys today as far as perinatal care, because I think it's important that every woman receives the care that she needs, regardless of her background. And we're Tennesseans. It's important to us to have healthy Tennesseans. So we're going to go ahead and get started and focus in on the significance of health accessibility in the perinatal period. We know that pregnancy, labor, and postpartum and beyond are very important phases for women. And it's not just important for the mothers to be or the active mothers, but it's also important for the babies and all of the communities within Tennessee. There are some decisions that women make during their perinatal period that will shape the well being of families here in Tennessee. And as facilitators or providers, each of you will play a key role in making sure that accessibility and awareness is at the forefront of perinatal care. I want to talk about a few decisions that women face in their journey, from selecting healthcare providers like an OB or maybe a nurse midwife, to talking about navigating finances when having a baby and postpartum. As we all know, having a baby is not cheap. So women are thinking about financial planning. Each decision that a pregnant woman makes during her period regarding her care will ultimately contribute to her proactive approach that will lead to a healthy pregnancy, a smooth delivery, and a positive postpartum experience. It's important to acknowledge that making these decisions can be overwhelming for pregnant women, especially for those women without a strong support system. And the goal is to empower mothers and provide fair access to perinatal services, regardless of race or any other factors that would get intertwined. I want every facilitator to understand that each woman's journey is very unique to her and is shaped by diverse considerations and the priorities that she has in her life. And the choices made by pregnant women will highlight their approach on what they believe is important when it comes to a comprehensive support system for both her physical and emotional needs. So, as we navigate through the significance of the perinatal period, I want you all to keep in mind that there are many factors that influences a woman's decision, from her OBE to her mental health to religious and social support and more. And that the journey to a positive experience includes a supportive network that cares for the well being of not just the pregnant women, but also for their babies and their families. So now that we've covered the significance of the perinatal period, I want to kind of shift our focus and attention to barriers that pregnant women might face from seeking the care that they need. And I think it's important for us as facilitators to recognize and understand the challenges that women are facing so that we can work together to address the needs and provide accessible care. So let's talk about what's actually preventing pregnant women from getting the care that they need. There are many barriers, such as socioeconomical, social barriers, physical barriers that can hinder a woman from getting the proper care that she needs and requires. And these challenges are affecting a woman's ability to go out and obtain what we consider essential services for them. And I want to spend a good time of this webinar talking about a few of those barriers. So we're going to talk about the barriers that they face, but I also wanted to put in real life case studies that will show what the barriers actually look like and what we can do as facilitators to not only address and acknowledge the barriers, but strategies and interventions that we can do to create less barriers or to help accommodate women seeking access to care. So we're going to talk about a bunch of we're going to talk about a few specific barriers that can be intertwined um, in different aspects. And we're going to look at some of the challenges. So, first, we're going to transition into the next topic, which we'll discuss some common barriers that typical women face during their perinatal period. Okay. So, according to the CDC's Reproductive Health Division, there are many barriers that can inhibit a woman from accessing proper prenatal care. And what I did was took a few of those barriers and created this list. And as you can see from factors like a lack of prenatal education, um, another really big barrier that uh, isn't discussed a lot is health insurance gaps, where women in Tennessee who are either underinsured or uninsured, where they actually face encounters of difficulties in assessing affordable prenatal services. I want to talk about how this highlights the importance of why we need advocates for comprehensive healthcare coverage. And then you have factors that you don't even think about, such as like fear and anxiety, a lack of social support, or something that is really big in my field as a doula is previous negative experiences. And so all of these can impact a woman's decision to even seek prenatal care. So creating a supportive and understanding healthcare environment is critical. And then you have issues that's outside of my scope of practice, like mental health and substance abuse. There's homelessness and transportation challenges. All of these complicate the accessibility of prenatal care. So we want to start to develop interventions that are needed to address these specific barriers. So, in addition to this, as a mother myself, limited childcare options. There's also unplanned pregnancy, um, provider availability. I'm here in Nashville, and everybody has their favorite OB here. and she's usually booked up for the year. So if you want to get in with her, that's not always easy. Excuse me. And then there are other factors like misinformation, disability, um, literacy, and more. And all of these present challenges for women. So, with the right support effort, organizations with a focus on maternal support can begin to build a bridge that will ensure that women are getting the support that they need. As the facilitator, you'll play a key role in helping these women who are facing these barriers that are listed on this broad topic. And not only will you be able to help them, but you'll also be that bridge to the barriers that they are encountering. And through your understanding and through your empathy and interventions and strategies, you all can work towards breaking down the barriers and helping these women actually obtain the accessible care that they need. There's this article by the March of Dimes that stated that access to maternal care is essential for preventing poor health outcomes and eliminating health disparities. And I thought that was really important to add to this webinar because some of these barriers are what I like to say, or what I like to call somewhat preventable. We can't stop them, but there are things that we could put in place to help make sure that women aren't continually being hit by this constant barrier. So a lot of these barriers are at the core of the Tennessee Strong Family Grant. And I want to take a look at how the grant and U.S. recipients can contribute to improving access for care for all of the women here in Tennessee. So I know we focused on breaking down barriers, but I want to take a look at how we as facilitators will play a key role in making sure that access to prenatal care services are available. So the Tennessee Strong Family Grant provides a unique opportunity to make a meaningful impact. And as grant recipients, it's important to know that your services are not only available, but they're also accessible to all of the women throughout the state. So I want to explore some later on. I want to explore some actionable strategies that you can actually add to your services to contribute to make a more inclusive perinatal care plan. Some of the strategies that I'll mention collectively aim to create a more inclusive care environment for women by addressing the barriers and ensuring that support services are tailored to those diverse needs of the women. By putting these initiatives into action, you as grant recipients can play a key role in promoting healthy pregnancy and healthy postpartum and beyond journeys. This will not only align up with the Tennessee Strong Family Grant, but it will also make sure that women here in Tennessee are having successful pregnancy, successful labors, and positive postpartum experiences. So we're going to move on into the core of perinatal care and look at defining perinatal accessibility and what that involves and how we can understand what women need for healthy deliveries and beyond. So this is a map of every county in Tennessee, and I want you guys to take a look at it to see um, where you are in Tennessee. And if you want, I would love for you all to share in the chat the counties that you are serving in. This map will is illustrating the level of access to maternal support in Tennessee counties. And following up with that study by the March of Dime, they had a portion that stated that disparities in Tennessee And access to care during pregnancy is not only available consistently in certain areas, but they're almost non existent in rural areas where the majority of the population include people of color, Black, Indigenous, and other people of color. And so, what they started to do was the study went and highlighted counties in Tennessee that were considered full access, meaning they had access to a hospital or a birthing center, an OB, or a nurse practitioner. And then there were counties that they looked into that had low access. Maybe they had an OB office, but they didn't have a local hospital. And then there was moderate access where maybe they did have a hospital, but it didn't include a maternity ward. Or maybe they had one provider who was the only one that would do labor and deliveries or even surgeries for women giving birth in their county. Excuse me. And then there was some counties, as you can see highlighted in red, that were considered maternity care deserts, meaning there was not just limited, but non existent access to maternal support. And some of the maternal support was not just provider, but it also included ultrasound places. It included childbirth education. And also, it talked about the ages of access for care for women in those counties that range between 18 years old up until you're about 64 years old, who could actually receive care within that county without any health insurance. I want to mention that a couple of the services that women need access to for healthy deliveries and postpartum, um, they range from a variety of things. So I'm going to focus on the highlights and the essentials. One thing that women need is prenatal care services, such as regular checkups. They need health screenings. They need monitoring, not just for them, but also for the baby. They Women need emotional and mental support. Um, they need financial resources and access to assistance that would help kind of alleviate some potential economical barriers that was related to their healthcare costs. Women needed safe living conditions. They needed access to, just overall health of their well-being. They needed a place where it was safe. And they also needed childbirth education, and they needed to know about pregnancy, about postpartum, and about what to do when they were in labor. Making sure that accessibility to these resources can overall contribute to healthy journeys for women. And I want to recognize that these are essential needs. And now I want to take a look into, we know what they need. So now I want to take a look into some challenges in addressing the disparities that the women are facing. This one was a really big challenge that, based on the map, all women kind of were placed in either in zone or an out of zone access to care. So when it comes to geographic disparities in perinatal care, it highlights that most women who lived in these remote areas, um, some of their areas didn't include healthcare facilities, so they were forced to have to travel long distance to just see their OB or see their nurse midwife, or dare they be high risk pregnancies and having to travel long distance to see a high risk specialist. So where you live in Tennessee definitely impacts your perinatal care. In faraway places with fewer hospitals, it's harder for those pregnant women to get the special care that they need. And traveling very long distance makes it even tougher. especially for those women who were in their later stages of pregnancy. And with this understanding of how where you live impacts your access to care, I want to move on and take a look at what a case study looks like that illustrates how we as facilitators can bridge the gap and geographical barriers that are affecting women from getting the care that they need. So this is Sarah. Meet Sarah. She is a 28-year-old woman who lives in a small town in Tennessee, and she's actually expecting her first child. And like many other women in her situation, she has encountered a few challenges as far as assessing perinatal care that's due to where she lives. Um, Sarah lives in a town where the closest hospital is nearly 40 to an hour long drive. So, as you can tell, some of the challenges that Sarah is encountering includes limited healthcare facilities. She's having to travel long distance, of course, and transportation issues. I want to spend more time focusing on strategies than I do solutions so that we can all collectively see what interventions look like for addressing barriers. So, if you have any other questions about the case studies that is regarding challenges, if you don't mind sharing that question in the chat, would be awesome. Because I don't want you to think that I'm not paying attention to it. I just want to really get to where we can uh, fill in a gap and build a bridge for the barriers that the women are actually facing. So here are three solutions that could help with Sarah's geographical issue. Number one, telehealth services. She could schedule an appointment from the comfort of her home, which would not only help her as far as traveling long distance, but it would help her stay connected to her providers and making sure that she's attending her appointments. Um, she could Her town could offer community outreach and education. So these these community programs could start to raise more awareness about the importance of perinatal care for Sarah and other women in her town. And they could educate these women in areas where these resources are not widely available, and they could talk about the importance of attending regular checkups, whether that's in person or virtually. And they could also provide information on other local services that could help her have a successful journey. And another solution that could help Sarah's geographical um, challenge would be programs like transportation assistance or transportation support. So Sarah doesn't have a car, and public transportation options in her area are very limited and close to non-existent. So she's relying on her friends and her family for rides, but that's not always a guarantee, which could lead to her missing more critical appointments that she would need. So the goal and the outcome of using these strategies for Sarah and other women facing her geographical challenges would be to help provide access to care that would be more convenient. So, telehealth and transportation and community outreach, all of this would foster a supportive network that would make perinatal care and her community a shared responsibility. And the case study shows that the importance of tailored solutions to address geographical challenges um, is very important for all women, regardless of where they're located in Tennessee. All women need to have access to quality care. So now that we looked at what a geographical challenge looks like, I want to take a look at um, another accessibility challenge, such as transportation and the ability to reach healthcare facilities, and how that plays a big role in making sure that pregnant women are properly taking care of themselves. So, we're going to look at two different case studies. One will focus on physical disability as a barrier, and the other may focus on transportation. So we'll go ahead and talk about physical disabilities and physical challenges that are impacting perinatal care. Things like not having wheelchair ramps in certain healthcare settings can be a problem for pregnant individuals who have mobility issues. And not only just not having ramps, but not having suitable resources like examination tables. All of these or not just, examination tables are important, but even not having a space that are friendly to sensory challenges for people could all like impact a woman who has physical disability. It could impact the way that she seeks out the care that she needs. So when it comes to providing perinatal care for individuals with these physical disabilities, one major challenge is that there's a shortage of healthcare providers who are actually trained in giving the care to these disabled individuals. The lack of training can result in providers' consideration in the specific needs of those with physical disabilities. So ideally, what we would want is healthcare providers who are knowledgeable about different care plans and who understand mobility challenges. So we need more providers that tailor care to individual specific situations. These physical barriers, such as no access to wheelchair ramps, can um, it can make a pregnant woman with these challenges kind of it'll definitely influence the way she sees and views taking care of her prenatal needs. So it's crucial to address that the infrastructure shortages that we have are a big key in reaching women who do have physical disabilities. Now I want to kind of look at a case study that will show how if we have tailored solutions for women with physical disabilities and what they look like in guaranteeing that she's receiving the care that she needs regardless of her disability. So this is Lynn, and Lynn is very excited about her first pregnancy, and Lynn is also in a wheelchair. So with limited mobility, she primarily relies on getting around with her wheelchair. So when Lynn goes to her appointments, she does need access to wheelchair ramps. She does need access to examination tables, and she does need access to providers who understand and create a care plan that's tailored to her specifically. So, what are some solutions that we can do as facilitators to help make sure that Lynn is getting the proper care that she needs? Number one, more accessible healthcare facilities, more wheelchair ramps, more elevator access, more examination tables, more providers who have experience and knowledge and training in working with women with challenges. Another thing would be uh, communication accessibility services. If she was having sensory issues or language issues, having available interpreters or having available sign language interpreters could definitely help create a more positive experience. And then having access to transportation services. So helping Lynn be sure that she's going to her appointments and that she's getting the care that she needs will help address the disability challenges to have a more inclusive perinatal care. Great. So now that we talked about physical barriers, now we're going to talk about access barriers related to language and cultural. We face so many challenges, such as not having available translators, not having available sign language, and also not having providers and healthcare doctors who are either bilingual or trilingual. And these instances of barriers can create a cultural insensitivity in healthcare as well as communicating with women who need this. This challenge highlights the need for healthcare practices that understand and include a variety of different cultures. So we're going to take a look at a case study involving language barrier and how the impact of cultural sensitivity on perinatal experiences in individuals and how that can positively make a difference on women. So this is Taylor, excuse me. So during Taylor's appointment, she is talking to her doctor and she expresses that her cultural practices and preferences related to childbirth. She tells all of this to her doctor. She shares what's important to her and what's important to incorporate in her pregnancy as well as labor and delivery. The issue arises when her healthcare doctor demonstrates a lack of cultural competence by not acknowledging what she's saying or even understanding the significance of her values. So, for instance, during her appointment, Taylor is African American and she has a big emphasis on family centered birthing practices. And she wants to have her family members present during her labor. So her doctor is actually unaware of this and he kind of dismisses the idea without an explanation, assuming that having too many people in the labor and delivery room would be against hospital policy. So, because of that, Taylor kind of feels a little misunderstood and alienated, and so her doctor has this failure to kind of recognize and respect her cultural preferences. And in a way, they don't know that it's kind of creating this disconnect with Taylor. Now, Taylor is in her appointment and she leaves, and she has all these feelings of isolation and feelings of not having the experience that she had and desired. So, despite her being excited, she's facing a lot of challenges in her perinatal care due to racial disparity in healthcare services. So, some of the challenges she's facing is limited healthcare resources, cultural competencies gap, financial barriers. So, what are some solutions that we can do as facilitators that would help address these challenges? You could offer community health outreach programs. We could talk about programs in areas where women are the minority, educating them on resources. Um, you can enhance cultural competency by hosting diversity trainings for healthcare providers, and that would help foster an environment where patients with different cultural preferences do feel acknowledged and respected. And then you can offer a financial assistance program that would help Taylor get the essential care that she needs without being um, kind of hindered by her financial status. So let's look at some numbers that show racial disparity in perinatal care and some challenges and how we can solve those within our racial groups that within our racial groups and communities here in Tennessee. So here are a few highlights that I was researching on Tennessee specifically, and there is a 4.6% chance that people of color do not receive the prenatal care that they need in areas that are high in poverty. And there's also a 14% likelihood of a lack of access to prenatal care compared to those areas of low poverty. American Indian and Alaskan Native women living in areas of higher poverty are 1.6 times more likely to receive a lack of prenatal care compared to those that live in areas that are considered more in low poverty areas. Marcia Dine stated that we need to discuss the urgency of addressing these disparities for more accessible prenatal care. Tennessee has a maternal mortality rate report that comes out every year. And in October of 2023, discrimination due to factors like obesity and race were also identified as factors in maternal deaths that were affected by the women in Tennessee. And I want us to understand these factors because it's not only important for the maternal health, but it also paves the way for more interventions and solutions that each of you as facilitators can do to help improve the access to more maternal support services. By providing pregnant women across the state with access to care that they need for healthy deliveries and healthy postpartum journeys. Which brings us to our next topic, which will discuss some systematic inequalities. We want to focus on identifying race, gender, and disabilities challenges that are presented in women who are struggling with getting the access of care. And when we address these challenges, we actually create a more inclusive perinatal care, comprehensive care for all the women here in Tennessee, regardless of their background. And we provide them with fair access to care that's not contingent on things like where they live, how much money they make, whether they're insured or whether they are aware of resources. Here's a case study that I wanted to take a look at. And Tony is a 30-year-old woman. She is of Mexican descent, and she recently moved to an urban community in Tennessee that is predominantly English speaking. Some of the challenges in accessing her perinatal care that she faces includes language barriers because she only speaks Spanish, cultural differences because she's new to this town in Tennessee, and because she's new to this town, she's not really sure on the available services that are available to her to have a successful journey. Here are some interventions and solutions that can help Tony have a more inclusive care. So, multilingual perinatal support services. If we connect Tony to a facilitator such as a doula who is fluent in Spanish and knowledgeable about both Mexican as well as American prenatal services, this can probably create a bridge between Tony and her healthcare providers. By connecting her, as a facilitator, excuse me, you guys, you can help provide services that are not only in person, but they can also be telehealth, such as telehealth translating services, virtual doctor's appointment, and so many more. But providing virtual services as well as in-person services will guarantee that Tony will actually seek out the care that she needs. Another thing that would be a good solution would be, once again, those workshops for healthcare providers. Facilitators can organize workshops that focus on cultural competency that's related to Mexican perinatal practices. And this can be a bridge to that cultural gap that would also enhance providers' understanding and create a more inclusive care environment. If they know more about Hispanic cultural preferences, there'll be more understanding of why it's so important to her. And then just locally, facilitators can initiate community outreach programs. These programs can be informational sessions that have multiple language interpreters available. They can educate about perinatal care, they can educate about available services, and help women navigate through the healthcare system. So, with these outcomes, one, we can improve communication so that Tony can talk to her providers as well as feel heard. We can also make sure doctors adapt their approaches to accommodate diverse cultural practices. And we can increase awareness and make sure that women are creating informed decisions and are actively participating in their perinatal care. Now I want to kind of move on to discussing factors that actually um, influence perinatal care on the lines of obtaining maternal support. So limited available services, especially for lower income individuals, creates a gap in critical areas such as doula support and mental health services. Other challenges arise in integrating these essential supports into traditional medical care settings. Um, so typically, most doulas have, I mean, not most doulas, most providers' offices usually have a resource wall with available services that contribute to positive outcome. But those services aren't necessarily integrated in their practices. So instead of referring out, the goal would to be have those services readily available there. Um, Having access to emotional and mental health support. Uh, but integrating these services isn't often achieved, which creates this gap for the individuals that actually need it. Individuals with lower income, they face significant challenges in assessing essential services that could contribute to positive perinatal experiences. So consider establishing a maternal support program that includes services like doulas and lactation services. And within these programs, you can provide doula services at reduced cost or for free. You can offer lactation support because that's equally important, providing stuff like free consults, breastfeeding education, resources to IBCLCs. All of that can help promote successful breastfeeding experiences for women and can also bridge the gap for having more integrated maternal support for women. We live in a very digital, virtual world anyway. So, launching things like support groups to connect women across Tennessee will also help aid in providing accessible care. So this list is it kind of outlines services that cater to diverse needs of mothers that will promote an overall well-being for not just the mother but also to babies. By incorporating these inclusive practices, organizations can contribute to more supportive, oops, I'm so sorry, more supportive, oh no, sorry, yeah, more supportive care, availability, and resources for women. So why is tailoring care so important? It's important because all women are different. Everybody has unique needs that they need to address. No woman is the same, no pregnancy is the same, no journey is the same. So tailored care will often acknowledge the diversity that's within perinatal experiences and help us create a more unique plan that is more tailored to that specific mother. We also have what we call evidence based practices that help improve accessibility to care. that focus that has a focus on medical support, emotional support, and social support. And these are strategies that U.S. Tennessee Strong grant recipients can add to your program to help enhance it and provide the care that women need, such as hosting monthly classes that cover pregnancy topics like nutrition, childbirth prep, postpartum care. You can offer this class in person, or you can even offer this class virtually. So I want to end and spend the last few minutes of this webinar looking at a case study that we can do together. It's interactive, so feel free to share your response through the chat. I'll take a look at the chat, or if somebody wants to speak aloud, that's totally fine. And I want to know what you in your organization can do as far as this case study goes in ensuring that this woman is receiving the care that she needs. There's no wrong answer, and it's very detailed for a reason because I know there's different focuses for each organization. So I want to kind of go ahead and dive into it, which will leave us a little room to really have a conversation about it. I want you to consider things that your organizations can do to help Maria, okay? So Maria is an expecting mom. She's 35 weeks pregnant. She lives in a small town in Tennessee, which is about 40 minutes away from her doctor's office and the closest hospital to give birth. Maria does not have a car, which makes it hard for her to attend her high-risk doctor's appointment that she's now scheduled to go to every twice a week because she has gestational diabetes. The transportation issue she faces leads to her missing appointment, but since she's considered high risk, she needs to go due to potential risk for her as well as danger to the baby. So she primarily speaks Spanish, and her provider speaks English. There are hardly any in-person interpreters at her office, which leads to her feeling a lot of fear and anxiety because she's not able to really communicate with her provider. So, what are some interventions or strategies you could do as facilitators to help provide the care of access to Maria's needs? I'm going to look at the chat. Telehealth appointments. Thank you, Chase. Telehealth appointments would be awesome. Exactly, because she lives 40 minutes away. So it would be nice for her to be able to go to these critical appointments, considering she does have a high risk diagnosis. Missing an appointment with a high risk diagnosis could be fatal. So that would be a really great opportunity for her to be sure she has the proper tools and resources for her care. Anybody else have any suggestions? Oh, I see. Offer translation services. That would be awesome. Melissa said access to transportation via Lyft, Uber. Yes. Access to medication assistance program for medicine or diabetic supplies would be awesome because some gestational diabetes moms do have to take medicine, with some maintain it by lifestyle. Thank you for that, Melissa. Yeah, providing transportation, Angie, that would be phenomenal. Kathy says, have a bilingual client advocate ready to meet her needs. Advocates could take her to her appointment. As a doula, that would be incredible. I've been known to take a lot of my moms to their appointments. That would be very important. Not only am I able to transport her, but we reach the other barrier of being able to communicate with her. And if I was bilingual, I could also interpret at that time as well. That is a great option, Kathy. And you said we have 96 non-English speaking clients currently at our center. So you definitely know the need for this. Yeah, all of these were really great ideas and great strategies. I want to thank you all for your good ideas. So, yeah, Maria's case study shows us the crucial role of integrating cultural competency into healthcare practices, creating improved communication and inclusive care for diverse communities. Derek said we would ensure that she had proper health insurance and explore their benefits within the packet. That would be great. Some moms are unaware of some of what their insurance is already covering. Some of them are waiting for their doctors to schedule translation services where their insurance actually they provide that for them in advance for their appointment. And they could pre-schedule that out their entire pregnancy. They don't have to wait to an upcoming appointment. Thank you so much for that, Derek. That was a really great idea. Love it. Thank you guys for interacting. I appreciate it. So, as we conclude, let's carry the valuable insight that we gained today during this webinar and into not only just our ears, but into our roles in the communities that we serve. So, whether you are a healthcare professional, a community advocate, or someone like me who is just passionate about prenatal health, what you do matters and it contributes to an overcome positive experience for women. I want to thank all of you guys for actually being here today and being a part of today's webinar, even on a snow day. And I really am thankful for the opportunity to teach on such a critical topic when it comes to accessible care for women in Tennessee and what they need and what they lack and what we can do to fill in a gap. I want you guys to remember that our journey towards equal and inclusive care is going to be ongoing. So thank you for putting your best foot forward. Each step we take to address barriers and personalized care will bring us closer to a future where every pregnant woman receives the support and services that she deserves. Not need, but deserves. So together, let's continue breaking down barriers and understanding women and what they need. And by doing so, creating more accessible care for all the women in Tennessee. Thank you guys so much. Um, I know I have a lot of information, so I know Brooke is going to send out a follow-up email if you guys want. It'll also have emails to other questions if you guys had those in the chat. But I want to wish you guys all success in your endeavors on enhancing perinatal care and accessibility. And for more questions, just go ahead and send an email to the strongfamilies@utk.edu. And once again, happy snow day, and thank you all for being here.
1 second too before everyone hops off. Thank you, Shay, so much for presenting this webinar and for sharing your stories of your clients with us and for bringing up different perspectives that sometimes we just don't think about because they're either not happening in our communities or, you know, whatever it may be. So we really appreciate you and thank you for your time. I will get this video to the FAU as soon as possible. And so they'll post it on the training website so that you can go back and review the information. And then also I'd like to offer, if anyone's seeing a specific barrier in their community that we maybe didn't address today, email us about that. And Shay and I can do some research and create a quick video and post that on our trainings website. If there's something that, you know, we went over a broad range of things today. If there's one specifically that you think could really help your organization, let us know. We'd love to provide further training on that. And then like Shay said, I'll be sending out a follow-up email this afternoon with our training evaluation and some other maternal care support documents so that you can have those for your reference. And I think that'll be it. So look forward to my email this afternoon That will also have information about our upcoming trainings as well, so that you can go ahead and register for those if you are interested. So we hope everyone stays warm and safe and has a great rest of your snow day with your families.